Welcome to Fighting Stigma and Promoting Recovery. Mental health is important for us to understand, to have a good definition. Mental health is the emotional and physical balance in the pursuit of wellness and a meaningful quality of life. It's an important part of our overall health. Wellness is being in good physical and mental health. It is impossible to be healthy without being mentally healthy. However, it is possible to be mentally healthy and have a chronic mental disorder. When we think about mental disorders, we're thinking about conditions involving the alteration in our thinking, our moods, and our behavior. It is associated with distress and impaired functioning. And when it comes to mental disorders, it's defined by a cluster of behavioral thoughts and feelings that have no underlying biologic pathology, which means that we've excluded all physical possibilities of why that person may be going through what they're going through. We're excluding physical symptoms before we decide on a mental disorder. There are no laboratory tests that are used in diagnosing a mental disorder. However, the global burden of disease still lists depression as the leading disease within our nation. So with participation, question: is the following statement true or false? To be considered healthy, a person also must be mentally healthy. What do you think? Well, the answer is true. A person cannot be healthy without being mentally healthy. When we think about epidemiology is really that study of patterns of disease and their distribution and other determinants within a population. It examines the association among possible factors related to an area of study, but not the cause of the disorder. And one of our biggest organizations that does that for us right now is the Center for Disease Control and Prevention. Stigma is something that we talked about earlier that can create a barrier into individuals receiving medical assistance. And there are different kinds. So you have public stigma, which is stereotypes that lead to prejudice and discrimination, or that labeling someone as being mentally ill. It's also attributed to words such as used commonly today, like they're dangerous or unpredictable or unable to function independently. I'm using words such as weak and immoral. The negative images that we may see in media and films. With self-stigma, individuals take what the public puts out there as stigmas, and they internalize that towards their own mental illness once they've identified it. And so they end up agreeing with the public perception. And then label avoidance is when others avoid care because they don't want to be labeled. The majority of the time, their desire not to be labeled has something to do with that public stigma. So they're all interrelated. Diagnostics. We use our DSM-5 to do this, and the DSM-5 includes subtypes and other specifiers that classify disorders. There are no absolute boundaries and no accounting for disorders that may be influenced by cultural factors. However, you don't see the DSM-5 used as much as we used to, especially since nursing is not really about making diagnosis, but hypothesizing on it. However, you will see throughout your textbook that there are some mentions of them, and then you'll see sometimes where there are some cultural syndromes that are listed. Recovery is the single most important goal. That's a process of change for each individual that allows them to improve their health and their wellness. It allows them to have a self-directed life, and it helps them reach a point in which they can have their fullest potential as far as living out their life. It's on your part. It's your role to make sure that you understand these basic concepts, which is that mental illness and emotional disturbances are treatable, that there is recovery-oriented care and trauma-informed care, that recovery is an expectation, and that there are ways in which we can support recovery. And your textbook actually talks about some of those if you guys want to look at that. And that really ends your lecture.